Guys, as you already know about suppositories, we already learned theoretically, right? So suppositories are nothing but semi-solid dosage forms, right? So you know about DT principles, design thinking principles. We have 5 principles. So I would like to request you. So can you please elaborate these suppositories in the scenario of this DT principles? As we know, we have 5 principles. Can you please elaborate all these suppositories and can you frame in the form of DT principle? Over to you.
Pharmaceutical incompatibility is somewhat complex, rare phenomenon that only expert deal with. You have seen the cases, nothing about them required advanced technology or genius level thinking to prevent. Where what they required was attention, discipline and respect for basic principle. And that exactly where all things fall apart. Look at every cases we went through. Drug mixed without checking compatibility. IV lines shared without thinking about interaction. pH include like that. It doesn't matter. Consumption made instant of verification. Different situation, same root problem. People stopped thinking. Isn't about lack of knowledge anymore. You already know enough to avoid most incompatibility issue. The real problem is behavior, rushing through steps, skipping checks, and trusting memory instead of confirming that facts. Here's the hard truth. In healthcare, I thought it was fine. It not excuse it is a failure. Because some small mistake doesn't stay small there. Slight incompatibility can inactive a drug. Patient gets no treatment. From precipitate blocked blood vessels, creates harmful compounds, cause direct damage, and the worst part, these outcomes are often silent at first. By the time you realize something went wrong, the damage is already done. So the takeaway isn't complicated, but don't take it lightly. Don't assume anything. If you haven't checked in compatibility, you don't know it is. It's safe. Don't rush the process. Speed means nothing if the result is wrong. Doesn't ignore the basic pH, solubility, stability. These are not optional details. They decide whether the drug works or fails. If you want to compete in this field, you need to build one habit: pause and verify before you act. Because at the end of the day, patient safety doesn't depend on how much you study. It depends on
more points on the empathize in suppositories special age-related considerations. So age-related consideration, children and elders patients have more rectal mucus. So formulations must be extra gentle and safe for this group. Next one, disease conditions for patients. So in these conditions like inflammations or infections make the rectal area more sensitive and non-irritant, and smoothing bases are preferred. Hydrations of rectal mucus. If the mucus is dry, insertions become difficult. So formulations may include the lubricating or moisturizing agent to improve the comfort. Osmotic effect of the excipient. This one, some cases like polyethylene glycols can draw water. Osmotic effect, which may cause the irritation or dehydration of the tissues if not properly balanced drug release requirement. Empathize helps decide whether the patients need rapid relief, that means fast melting bases, or
suppositories is one of the semi-solid dosage form, and it's have lot of advantage and a lot of disadvantage also. The advantage is without the conscious patient also use for suppositories, and disadvantage is the suppositories using is patient have an embarrassing situation, and it's have various types. First, it has main 5 types: rectal, urethral, vaginal, nasal cavity and ear bone. First one is rectal. It's used insert into rectum, and main is suppository used for body cavity.
Antioxidants such as butylated hydroxylate. This compound helps in protecting the formulation from oxidative damage, thereby enhancing stability and longevity. But here is the most important the point: every decision we make in this stage must be balanced. When we add one excipient to solve a problem, we must ensure that does not create a new issue. For example, adding too much beeswax might make the formulation too hot. Using a surfactants in excess could cause irritation. Adding antioxidants might sometimes affect compatibility with other ingredients. So the ideal stage is not about adding compounds; it is about selecting the right combination in right proportion. The stage can trial thinking combined with scientific reasoning. We mentally stimulate different combinations, predict the interaction and anticipate outcomes. Later, these ideas are tested practically in the lab. Some combinations will fail, and that completely normal. Each failure provides insights and brings us closer to the optimal formulation. In addition, stage also involves considering fashion acceptability. We think about factors like texture, appearance, smell, and ease of applications. After all, a formulation is only successful if fashion are willing and comfortable to use it. To summarize, the ideal stage is where they explore, experiment, and refine our ideas. It transforms theoretical knowledge into practical solution. It is a dynamic and iterative process that requires both creativity and technical expertise. In simple words, the stage is about asking what if we try this, and then continuously improving until we find the best possible formulations. Thank you.